Thank you. I am sad to be here, actually, as one of the smallest states in the country that has a huge crisis of heroin and opioid abuse. I think this is a health emergency. It's a national health emergency. This is a pandemic. This is not just an epidemic. And we need a federal response to address it. In New Hampshire, we're losing about a person a day to overdose deaths. If you compare that last year, it's 3 times as many people as died in traffic accidents. In 2014, we lost 47,000 people across this country due to death from overdoses from heroin and opioids. And as I have traveled around New Hampshire, as I have talked to the firefighters and the police officers and the treatment providers who are on the front lines of this crisis, what I hear everywhere is what we need are resources. And we need resources that address not just law enforcement, putting the bad people, the pushers behind bars for interdiction, but for treatment, because this is a disease and it's a recurring disease. We need to provide treatment. We need to look at what works, things like prescription drug monitoring programs, things like drug courts that make a difference in communities at prevention and education. And so what I have done is introduce an emergency supplemental appropriations bill for $600 million that would look at supporting those programs that we know are already in existence, that already work. I'm pleased that the Judiciary Committee has passed CARA, the comprehensive bill to address fighting heroin and opioid abuse, but it's an authorization. And what we really need are resources. And if we think about what we have been willing to do at the federal level in the past, in 2009, we appropriated over $2 billion for the swine flu epidemic. Just last year in 2013, I guess, we appropriated over $5 billion for the Ebola epidemic, and yet we only lost 1 person to Ebola in the United States. Now, I think that was important, and we needed to do what we could to help fight that outbreak. But we've lost 47,000 people in 2014 to the heroin and opioid problem, and we have got to provide funding at the federal level to help states, to help communities deal with this crisis. We owe those people on the front lines that. We are not going to get a handle on how to get this under control unless the federal government steps up and provides resources.